Thanksgiving is all about bringing people together, but this year both the governor and the CDC are warning to keep celebrations to your household only. It's the latest effort to get coronavirus cases under control. So joining me now is CBS 4 medical editor Dr. Dave Hnida. And Dr. Dave, a lot of people might be saying, well, I'll just get a COVID test before I go to Thanksgiving dinner. What's the problem with that?
Well, if you wind up getting a test done and it's positive, and you know that you've got an issue there. But a negative test is really not a guarantee that everything is going to be well and fine when you wind up getting together for a Thanksgiving meal, for example. I think that there are several things to understand about testing itself. Number one, a test is actually a snapshot of what's going on at the time you get that test done. There are circumstances we know where people are infected, but they have very, very low levels of the virus in their body, so low that a test will not wind up turning positive, and so they wind up getting a negative result. Yet, over the course of hours after that test is done, the virus in the body multiplies so much and so quickly that a person does become infected. And even though a test, let's say at 3 o'clock may be negative on a certain day, at 5 o'clock that test could be positive. Number two, we really do worry about the fact that you have a test done on a particular day. What's to say you cannot become infected in the hours or days afterwards until you wind up getting together with people? And then the third thing to think about is the fact that a test may simply not be as accurate as you think it might be. This is especially true if you're not having any symptoms. If you're asymptomatic and you wind up having a rapid test done, there's a likelihood that that test is not going to give you the correct result. This is especially true when you think about somebody who, let's say, is going to hop on a plane, fly into Denver, and have a test done even after they get to Denver. It is just not likely that that test is going to be positive if they are not having any symptoms and they're looking for that rapid result. I think really the bottom line is that we really are in a place where testing is not a replacement for masks, social distancing, and staying within your own household when you get together for Thanksgiving.
That's interesting. Yeah, a lot of people were wondering about that, so appreciate that insight on that. The state originally projected we would hit our hospital capacity by January. Mesa County has already reached its capacity, and it's only November, so is that alarming to you?
I think everybody in healthcare is alarmed right now. As you say, we were thinking maybe January overloads here, but yet what's going on is, we're in November and we are in a crisis situation because cases are just skyrocketing at a straight up trajectory. The issues boil down to the fact that, number one, we're really running out of beds. That means that there may not be enough beds in a particular facility. We can't transfer easily patients from one facility to another facility. We know that there are some emergency rooms that are in fact diverting ambulances to other facilities because they simply cannot take care of patients. They just don't have the beds to do so. And then you look at staff. Staff is usually important when it comes to the care of COVID patients and just healthcare in general. If there's not enough staff, we just can't take care of you. And this is a hugely important thing to consider right now. Look back at the spring when everybody was going to New York to help out there because that was a hot spot. Well, right now, every place is a hot spot. So it's not as if Colorado can simply have physicians or nurses or other staff come to help us out here. We're pretty much in our own place right now where we're not going to be able to rely on many others for help. So let's get down to the bottom line here. What does this mean for you? It means for you that if you get COVID, we may not have the ability to care for you in a way that we would otherwise like to be able to do. We just simply may not have the beds and the staffing. And number two, let's say you don't get COVID, but yet you need hospital care. Let's say you get in a car accident. Let's say you have a heart attack. let's say you need your appendix out. We don't have the facilities, we don't have the beds, we don't have the staffing to take care of you. So this has a really direct impact on your life. And so once again, I think if there's a message from healthcare workers here in Colorado, it is please follow the recommendations from the health department and from the governor.
Great. We know with indoor dining no longer being allowed in many counties, restaurants are coming up with those creative ways for outdoor dining as the weather gets cold. We've seen a lot of those tents and even smaller enclosed spaces kind of just popping up. Are those safe?
Well, it's interesting because when you think about it, if you take an outdoor space and then you enclose it, it essentially becomes an indoor space. So really what you want to do, let's say you're going to go dine somewhere in an outdoor setting, so to speak, really what you're looking for is a place that has at least 2 open sides, because you need adequate ventilation. Ventilation is huge when it comes to spread of the virus, and that's particularly true in a dining setting. You need to make sure that there's adequate spacing between people who are dining, as there's not a lot of movement in between tables. Recognize the fact that, nobody's going to be wearing a mask because they're eating. So it is a very tough environment to be in terms of being assured that you are protected. And now let's take a look at those little bubbles or little self-contained igloos that are popping up through there. I mean, they're great ideas, but I think there are a couple things to consider here. Is that if you're going to go into one of those very small structures, it really needs to be with members of your own household and your own household only. I think that you also need to be very sure that when the previous party has left that little bubble or igloo, that there's at least 15 minutes or so to get that place aired out, ventilated before you go in and begin dining. And there also needs to be really good disinfection of that individual bubble or igloo or whatever you would like to call it. So I think overall, we can hope for a good dining experience as we go through the winter, but by no means can you say that it is a risk-free situation by simply being outside. I hope we're able to do it.
I hope so too. I've seen a lot of restaurants, that's the only way that they can have people and make revenue. So very interesting. Thanks so much, Dr. Dave, for all of the helpful insight. We'll talk to you again next Monday at 11 a.m. as we answer more coronavirus questions. And to see all of our Q&A with Dr. Dave segments, just visit cbsdenver.com. We'll be right back.